A report by UCLA's Latino Policy and Politics Institute shows a severe underrepresentation of Latina physicians nationwide, and we have that same issue here in California. KCRA3's Marisela de la Cruz spoke to one doctor who knows firsthand why this type of representation is so important.
Jeanette Canchola.
Closing health disparities, one graduate at a time.
We need physicians to be more like society, because society and our patients need to trust us in order to follow our advice.
As a Latina physician shortage worsens statewide.
In California, as well as the rest of the country, the physician workforce doesn't really match up with the population or the patients that the physicians need to ultimately work with and serve.
While Latinos make up 39% of the population, they only make up 6% of physicians. And when it comes to women, that number is even lower at 2.7%. Yesenia Ramos is part of that fraction.
I know what it is to be underserved and come from a low-income background, so I get it when they tell me some of their problems. I think it's rewarding to be able to come back and now serve those patient populations.
After coming back to her hometown, she says her goal is to serve Sacramento's most underserved populations.
On specialty care, it's like as the disease is more complicated and more advanced, like the need for someone to be there to explain that to the patient.
And while she's grateful to be practicing, she says these numbers could change if more resources were made available.
Tutoring and programs that help underserved, low-income students do well in these MCAT like the tests, all these entrance exams. So I think that's one thing that we could work on, getting the scholarships and the resources to help academically.
At the moment, there are roughly 100 Latinas who are studying to become future physicians at UC Davis, and the university also works with local colleges to encourage people from different backgrounds to go into health careers. In Sacramento, Marisela de la Cruz, KCRA3 News.